is, do you have a recommendation for an optimal time to introduce a palliative care physician to an oncology patient with progressing disease? This goes back to that TEML study, where the TEML study, again done about 10 years ago, took patients with cancer and entered them with palliative supportive services at the time of diagnosis. And then they took a control group and followed both groups, one that had palliative support and one that did not, and they just followed them forward for a couple of years. There wasn't any impact on the treatment decisions of what kind of chemo regimen they get, et cetera. They matched them up and then they followed them forward. And what they found was, as I said earlier, the patients with palliative support lived longer, lived better, stayed out of the hospital, and cost less money to the system as a whole. And it was simply because of this attention on symptom management and for the support of real conversations as well. So my answer would be the sooner the better. Many oncologists are open to a collaborative relationship with palliative doctors. Some of them still see palliative as sort of pre-hospice or the same as hospice, and we're not ready for them yet. But if you're finding yourself walking beside a loved one with cancer and you're worried about symptoms that aren't well controlled, or where are we in this, and let's have a real talk here, that's a good time to ask the oncologist. What do you think about asking your palliative colleague to fold into the care here?
Tim, just a quick thought. I just read this quote earlier today, as a matter of fact, and when someone has a life-limiting diagnosis, the saying was, "It's always too early until it's too late."
Yeah.
And so, obviously, we believe earlier is better.
Yeah. Somebody